Hello, my name is Dr. Valerie Masuda, and I'm a palliative care physician. And welcome to Tea with Val. And today we are talking about the difference between palliative care and hospice care. So, when you've been given a life-limiting diagnosis, your life becomes a bit of a timeline between diagnosis and the end of your life. And hospice care is actually the care we deliver to people at the very end of their life. But palliative care is the care we give to people from the time of diagnosis of life-limiting illness until their death. So hospice care is part of palliative care, but it's not all of palliative care. Even if you'd want to extend your life, possibly by taking treatment, then palliative care still is an option. So what is palliative care? Well, palliative care is really coming to an understanding both from your perspective and your healthcare provider's perspective on what is your illness and how does it impact on you? What are your beliefs? What are your priorities and goals? And how do we align your medical care for your priorities and goals? Not the priorities and goals of your healthcare providers, be they the family doctor, your oncologist, your surgeon, but aligning your medical care with your own priorities and beliefs. Palliative care also is about symptom control, and symptoms can be from your primary life-limiting diagnosis or illness, or it can be actually due to treatments that are designed to try to prolong your life. We also offer emotional, social, and spiritual support. And this can be in the form of a hospice volunteer providing emotional support. It can be in the form of group therapies, group support therapies. Social support can mean things like filling out forms, supporting you for advanced care planning, your health representation agreement, estate planning. It can be filling out forms for compassionate EI for family members, or other kinds of provincial or federal programs that you could be able to access, as well as accessing private programs that may be associated with your work. And also spiritual support that can come in many forms. As your trajectory moves closer and closer to your end of life, managing symptoms becomes more of a priority, but also starting to engage nursing supports, supporting you and your low energy at home with care supports that can be equipment or people. And then moving to hospice care, which can be at home in the form of nurses and physicians coming to your home. It can be in the form of a residential hospice. But in both those venues, we have appropriate nursing care, personal care, and emotional and spiritual support along with your physical care. And palliative care also encompasses after death care, which is in the form of bereavement. Reiterating, it's about communications. Communications first with your healthcare provider, hard and courageous communications with your family members about what your goals are, what your priorities and beliefs are, and what you should do with your medical care. And it's about time. I always consider this time between the diagnosis and the end of life as sacred time. How do you want to spend that sacred time? Is it going to be seeing a grandchild graduate? Is it about taking that really important trip? Is it about watching your grandchild being born, or just spending time with family, spending time with self, whether it's watching a sunrise or sunset, breathing the fresh air, looking at the leaves and flowers, or listening to the birds. Sometimes that time can be spent with surgery, with investigations and blood tests, can involve chemotherapy or other treatments. But time is a funny thing. When you're diagnosed with life-limiting illness, time seems really short and too fast before you die. But as people get more and more tired, time seems to slow down. And it makes time for spending time with friends and family, things that are important. And your medical team comes to you. Your physicians see you at home or in hospice. Your nursing care is focused at home for as long as it can, and for many, up until the time they die at home. But it's about people and connection. That every breath that you breathe has meaning until your last breath. And then palliative care being the support of the bereaved as they're left behind. So I hope that this has been a good way of explaining the difference between palliative care and hospice care. Once you've been diagnosed with life-limiting illness, it's never too early to engage a palliative care team. Science has shown that early engagement with palliative care can actually extend your life. And it also extends your quality of life. It helps you and supports you for your emotional and spiritual well-being. And it helps you make the most of what is left in this sacred time.